Hello, everyone, and thank you for joining us for today's webinar, The Art and Science of Empathy in the Healthcare Environment. My name is Jeff Murphy, and I'm an Associate Director in the BU Alumni Relations Office, as well as a proud alumnus of the BU Questrom School of Business. Today's webinar is sponsored by the BU Alumni Association and is offered to our 312,000 alumni around the globe. Throughout your career, the BU Alumni Association is committed to helping you define and achieve your professional goals. We aim to do this by providing alumni with access to a series of valuable online tools and social media communities. It's important that we get your opinion on how we're doing, so we very much look forward to receiving your feedback via a short survey that will be emailed to you later today. I know we have alumni joining us from places like Durham, North Carolina, Elk Grove Village, Illinois, Denton, Texas, Hollywood, Florida, and as always, dozens of Massachusetts alumni from towns like Concord, Ipswich, Roxbury, and more. For each and every one of you out there, please know that we really do value your opinion on this and every program that we offer. Before I introduce today's speaker, some brief housekeeping notes. As you know by now, this webinar is being hosted on the Adobe Connect online meeting platform. If you experience any trouble with the audio or visual portions of today's presentation, I'll ask that you please contact Adobe Connect directly, and I'll give you a phone number if you want to jot it down. It's 1-800-422-3623. Today's presentation is being recorded and will soon be made available for on-demand viewing on the BU Alumni Association website found at www.bu.edu/alumni. Our speaker is very eager to answer any questions that you may have, and you're welcome to submit them throughout the presentation using the Q&A chat box you should see at the bottom of your screen. We hope to get to as many questions as we can during today's webinar. Now it's my pleasure to introduce our speaker for the day. Presenting from beautiful Lenox, Massachusetts is Lynn Festa. Lynn is a 1988 grad of the BU Sargent College Occupational Therapy Program. She's been a certified hand therapist for 21 years, attaining her certification from the Hand Therapy Certification Commission in 1995. She felt that the increased pressures of the healthcare environment were adversely affecting her ability to effectively treat patients, and Lynn began to explore alternative ways to provide quality and compassionate care while maintaining her passion for her profession of occupational therapy. Her career as an OT has expanded from the role of certified hand therapist to that of a health professional coach. She now offers workshops, webinars, and in-service trainings focused on the well-being and improved resilience of the healthcare provider. In addition to her OT degree, Lynn is a certified Daring Way facilitator and holds a certification in positive psychology from the Whole Being Institute. Lynn, thank you so much for being here with us today. I'm going to turn the floor over to you. I'll get your slides up and running. And as soon as you see them, go ahead and take it away.
Great. Thank you. We're waiting. Yep, there's the slides. Oh, I love technology. Welcome to everybody who's able to join us on today's webinar. I appreciate your attendance. So yeah, you understood how I got here. And I really think that the intention of this webinar is to kind of share what I've learned over the past 3 years as I've gone on this journey of finding a better way to reignite my passion as a certified hand therapist. I did find over the course of those 21 years that it became a little bit more difficult to show up at work. And show up and offer the kind of care that I really wanted to do. So over the course of the past few years and the Daring Way and the positive psychology, also with my occupational therapy degree, I've really started to develop this offshoot as a health professional coach. Jeff, if you can you do the first question for the poll? I want to get a sense of who's attending today. Cool. Okay, great.
So you're seeing those results come in, Lynn?
I did, because I'd like to actually, oh, hold on.
It'll take a couple seconds for folks to chat their answer in. Just everybody who's on, go ahead and select either yes or no from the menu by hitting the radio button that you see next to it.
So let me explain a little bit more as those are finishing.
The Daring poll.
Yeah, the poll. Oh no, it's closed. Excellent.
Yeah,
okay, so yeah, 63 to 36. That's great. Because actually, when Jeff and I were talking about how to structure this particular webinar, he did ask me to do it from the perspective of also the patient or the person seeking health care. So actually, you'll see that that's what I was able to do. So let's jump right in. Here is a picture of the arena. As Jeff said, I did get my certification in the Daring Way. And what that is it's a evidence-based curriculum based on the work of Brené Brown. So you'll hear me speak a lot about Brené Brown because that's a lot of the work that I'm using in my work. You'll hear me quote Martha Beck because that's the life coaching training that I did that started me on this journey. And also I will also bring in things of positive psychology. But what I want to talk about for the rest of the intent of this webinar is from the arena. And Brené says the arena is any moment when or place where we have risked showing up and being seen. Now, again, from the patient's perspective, the patient's arena, chances are at this day and age, nobody's showing up for wellness visits anymore. And if you are, it still can be stressful. Chances are you're showing up, you didn't plan to break your arm, you didn't plan your heart attack, you didn't plan any of this. So from the patient's perspective, this is all a very new, scary, very unexpected place to find yourself. Sometimes to kind of break the ice with some of my patients, I'll just say, something tells me this wasn't what you had on your calendar for Tuesday at 1 o'clock, was to see me. Something tells me you had something else and a lot more fun planned. But from the provider's arena, I think this is really important to remember that we are clinicians, not magicians. For those 63% of us that are healthcare providers, we know that things have changed drastically, especially in the last 10 years. There are rules, there are regulations, they change constantly. According to Medicare, who will change the rules on I'm being ironic here, on a daily basis. If we don't follow those rules and regulations, how we come across, and we're not following them, will actually come across as fraud. So that's a very difficult place for us to be. We are also doing more with less. So that's the arena that we're walking into as healthcare professionals. So I want to start right out with a tool. And the tool that I love to start with is something called a permission slip. I usually like to tell people, start out with permission to be human, permission to do the best job you can, and then let it go. So if you're finding yourself facing a difficult day, seriously, just take a sticky pad, right? I give myself permission to whatever you need to give yourself permission to do. Maybe not know all the answers. So, Jeff, can we get this pulled up? There's a nice 3-minute video that's actually on YouTube, so it doesn't come up. You can go find it. It's Brené Brown, and she does a wonderful, wonderful explanation of empathy.
So, Lynn, as you and I know, when we tested this yesterday, I want to make sure that our participants today know that sometimes video streaming on this Adobe Connect platform doesn't work out so well. So what I'm doing is putting up a chat box, and I'll ask that people let me know if you're having any trouble hearing the audio of the video or anything like that. Please know that the rate at which you see the video is actually going to be dependent on your individual internet stream. So I'll put that out there. We'll go ahead and I'm going to click start, Lynn, if that's okay with you, and then folks should let me know if they're having trouble.
Great.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy: perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth, staying out of judgment, not easy when you enjoy it as much as most of us do, recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here. And you're not alone. Sympathy is, ooh, it's bad, no. You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful. And we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
All right, Lynn, it seems like the video ran okay. Did it end on your end?
That's great. Yep, it's all good here. Just waiting for my slides to come back up, and then
I'll get those right up.
Here.
Hang on one second.
Great. So what I'm going to do with the remainder of my the time that we have together is really talk about what empathy is. And actually, what I'm going to do is hopefully provide tools that you can actually use this afternoon if you're actually walking in to see patients or walking into your arena of your own healthcare. Now, our empathy is an art. I try to think of it as a verb and an ongoing practice. They say that empathy can be taught, with the parentheses that are really important, for those willing to learn. The joke in my world is empathy can be taught to everybody except two categories, and that is the psychopaths and the dead. So anybody who actually is willing to learn probably doesn't fall into those categories. What I like to really point out about empathy, though, is you have somebody revealing, like we saw in the video, somebody listening, and in between that becomes an understanding. And what I'm finding as I'm telling people what I'm doing and this is what I'm focusing on, it's always fascinating to see the reaction. The reaction mostly has been, this is really important and we need this in healthcare. And I can't agree with that more, because the first day that I started doing this, it actually made me a better clinician, and I'm just so psyched about that. But the biggest resistance that I find is that mostly it's from the bottom. It's just one more thing that I need to add to my day when my plate is already really too full. That's actually the strongest myth that I've heard, and I actually respectfully, strongly disagree with that statement, because it actually takes less time. Now, with anything that we're learning, I want you to know that it is, like we talked about, it is a process. And it is an art. As you can see what Brené says, that we try empathy, screw it up, and then circle back and practice it again. Empathy is one of the most foundational expressions of trust. Again, permission slip to screw it up and circle back. The more that you do this, and I'm speaking from personal experience, the more that I realized, oh my goodness, I was that person saying, at least you have another hand, or at least it wasn't your dominant hand. I realized what I was doing by saying those at least ones was I was creating a bigger dissonance between me and the person I was treating. So permission slip to practice this and screw it up and circle back. But what she talked about with empathy, and the key ingredient is trust. Now, trust is been shown to be the quickest way and the most important predictor of adherence to treatment, which adherence to treatment then turns into better patient outcomes. Now, they say that trust has to be developed over time. Well, those of us in the healthcare setting don't have a lot of time. So we need to develop that trust between the person sitting in front of us. And then the person sitting as a patient also needs to provide that trust too. So trust is also a two-way street. So one of the most important tools that I'd really like to focus on for the next few minutes is called active listening. In a study by Langowitz and al. In 2002, spontaneous talking time at start of consultation in the outpatient clinic, a cohort study, found that, minus the outliers, a patient will tell you everything that you need to know in 92 seconds. The quieter you become, the more you can hear. Or if you really need it a little bit more blunt, the patient is trying to tell you what's wrong with them. You have to shut up and listen. Now, sometimes 92 seconds seems like forever, but truly, except for the outliers, they will tell you everything that they need to know. At best, if you can, maintain eye contact, or as it was done to me as a patient, and I immediately trusted my doctor when he said this. He said he was doing his intake, and he was on the computer, and he turned to me and he said, well, now that I'm on EMR, that's the last eye contact we will have until I start your examination, which he explained to me why, made it funny, and I immediately trusted him because there was no eye contact. He was too busy listening and typing. Also, it allows you to set the agenda for the session, and the patient will actually feel heard. Now, for anything in life, there's blocks to listening. And looking at the list on the left, we can probably all see ourselves in each of one of these. In the healthcare environment, sometimes we're rehearsing what we're going to say, we're filtering, judging. None of us are going to admit to dreaming. But you can see that these are all things that actually will stop the active listening. So what I'm going to jump into with our remaining time is go through the 5 attributes of empathy by Teresa Weissman. And the first one is perspective taking. And there's a wonderful book by Nicholas Empley called Mind-Wise, Why We Misunderstand What Others Think, Believe, Feel, and Want. And up there you can see his definition of perspective taking. It looks very similar to that of empathy. But what I really like about Dr. Epley's work is he talks more about perspective getting. And if you think back to the active listening that we just talked about, this really ties in. And it seems subtle, but it actually makes a world of difference. If you get somebody's perspective by listening for those 92 seconds, it's 50% more effective than perspective taking. It doesn't allow for any stereotyping because you're just sitting there and listening to what the patient has to say. It removes all assumptions and all the guesswork because you're just sitting there to get the perspective. And again, this can work. I like this one because it also works both ways. When you're done, say you're the patient and you're done with your 92 seconds, and the clinician is trying to explain, you're going to get the perspective of the clinician and listen also. But let the storyteller tell the story. And wonderful tools to really focus in on perspective getting is to start the session if it's a new patient and say, what can I do for you today? And that will start the session off in the right way. What would you like to focus on today if it's a follow-up? And actually, if it's also a follow-up, lead the session with a strength, as in what's working, what has gone well. From my perspective, an occupational hand therapist, I like to ask the patient, well, what's new? What have you been able to do since the last time you were here? Truly one of the most exciting things that people get back is being able to tie their shoes. That just sends us all into a wonderful place, because try tying your shoes with one hand. I also know when somebody's actually starting to do better when they walk in wearing jeans. Also impossible to do with one hand. So I usually get really excited when they walk in, lead with the strength and what's working. Hey, you look great in those jeans. So number 2 is staying out of judgment. And as we saw in the video, it is actually quite difficult for, I don't know, most of us. I usually try to challenge people to say, see how long you can actually stay out of judgment, and see if you can catch yourself making up a story about something when you actually really are truly making up the story. You don't actually know the why and the where behind it. So you can't assume that you know their story. Also, trauma is in the eye of the beholder. And this lesson was really taught to me by one of my patients, where I think some of the best lessons are. There was this gentleman who had a postoperative hand surgery, fairly complicated, but this gentleman was in a motorized wheelchair. Surgery was on his dominant hand, so right there, working against him, and he had a laundry list of things that were not working in his favor. So I realized that I took a look at everything, took a look at the op report, took a look at his medical history, and thought, oh no, there's no way. Well, in Medicare, we have to ask the patient, how do you perceive your health at this time? Excellent, very good, good, fair, poor. Didn't that guy look at me in the eye and say, my health is excellent? So he taught me to set the tone for the rest of it. And yes, he sailed through it because he decided it was excellent and this was going to work. So recognize emotion. And you can see that we all have 5 core emotions at all times. You can see I did a little editorial at the bottom. Sometimes we're just hangry. Maybe we've been waiting for the doctor's office and we're supposed to be fasting, and we're just really angry because we're hungry and we missed a meal. But every situation will come down to one of these 5.5 emotions. These are actually tools from Martha Beck, and to help communicate that emotion and to let the person know that you've actually heard them. And like I said, this can actually go both ways. It can come from the provider and it can actually come from the patient. And it's actually pretty important to get this sentence just so. It's not tell me if I'm wrong, how I'm wrong. Tell me where I'm wrong. But this sounds like it has been stressful, hard, difficult, whatever for you. Or if you found that the person had a little bit difficulty time explaining something, whether it is the provider or the patient, you can really hone in on what needs to be focused on by saying, say more about the treatment or say more about it. And that will also help to communicate the emotion between both parties. Mindfulness. I know that there's, and I really appreciate mindfulness, and there's been a lot in the literature lately about mindfulness, and I'm actually slightly frustrated about it. There's my editorial comment, because they'll talk about mindfulness programs, and I feel like it's an incredibly important part of all of this, but it isn't the whole thing. So I really would like, that's my focus, to take this, have mindfulness and be aware of it. And it is a part of being empathic and doing all of this work, but it really is a part of it. Biggest, the one that and you can see everybody has their own way to talk about mindfulness, and I think that's great. When I'm having a day where it's a really busy day and I'm having trouble focus and maybe I'm just a little bit off, I go with the bottom one and I shake it off and I say, just be here now. Well, no talk is complete without talking about self-compassion, and that's the work by Kristen Neff. And as you can see, she breaks it down into self-kindness, common humanity, and mindfulness. Self-compassion boils down to, and there's whole books on this, but the best way to explain self-compassion is that if you talk to yourself like you're talking to a loved one. So when you're starting to beat yourself up and you think, oh, I didn't get it right, or I'm not good enough or something, talk to yourself as if this was somebody that your loved one came to you and started to say these things. How would you respond? Now, as you can see from all of this, I think this is really important. But please take responsibility for the energy you bring into this space. And what that means is we all, especially as providers, have a responsibility to acknowledge what we're going through, the situations that we may be in, but also know that we need to show up, be seen in a way that's productive for everybody. So if you are mad, if you are sad, name it. Sometimes I feel like the patients who I connect with the best, that I go in and I introduce myself and, hi, I'm Lynn and I'll be your hand therapist. And they look me right in the eye and they say, I am so scared about this. I am so worried about this. Talk about taking responsibility, and then I get to meet the patient where they are. Now, I've also learned, again, say there's no at least, and there's no telling somebody to not acknowledge their emotion. I think that's really important. And so usually I'll thank them. I'll thank them for their honesty. And then I try to calm them down by saying, look, we're going to try to get this. We're going to get you feeling better as soon as we can. And then to wrap it up so people can get back to healthcare, is I think that this is really important. Studies have shown that when patients are discharged from hospital, they retain, and it's an alarmingly low amount, they may retain 40% of the instructions of what they were told because they're just in overwhelm. So again, a good old, wonderful Maya Angelou, I've learned that people will forget what you did, people will forget what you said, but people will never forget how you made them feel. So I hope that I was able to provide at least some things that actually people can take back into the arena of healthcare and into their next doctor's visit. So Jeff, we want to open the floor for questions. I also understand that people may be leaving the chat room. You can actually email me at any time with the email above.
Lynn, I think we might have lost your microphone there for a second. Can you readjust or?
No, I didn't move.
Oh, okay. Whatever. Your last comment about people emailing you, could you repeat that?
Oh, sure. Is that better?
Yes, that's right.
Oh, great. Now, there's my email address. Feel free to email me at any time if you have questions or you need some explanations or would like more references or resources about any of the things that I referenced. This does come with, I did send a PDF resource with a lot of the articles and books that I recommend that I took a lot of this information from.
Yeah, I wanted to make sure we talked about that as well. As Lynn said, we have a PDF document of other resources that I'll be emailing to all of you along with the survey email later this afternoon. So definitely keep an eye out for that in your inbox. Again, people, feel free to ask your questions using the Q&A chat box at the bottom of your screen. We've got plenty of time to get to those. Lynn, while those are coming in, why don't we go ahead and, I know that you were curious to see if folks had attended other presentations on this topic, so I've opened up this poll question here. And again, just hit either yes or no using the radio buttons that you see that correspond. And Lynn, obviously, looks like this is the first time that a lot of people have been able to attend a presentation on this topic.
Okay, well, good. I hope I was able to provide. Oh boy, and that's where Jeff and I talked yesterday. I think the challenge of this is Usually I put on 6-hour workshops on how to empathy and resilience in the healthcare environment. So to bring it down to 30 minutes was actually really tough to challenging. I love a challenge to figure out the best way I can actually provide some tools that people can take back in. So yes, I do think that this is a much needed thing. And truly, I think the best thing that I've gathered over, like I said, from that first day I walked in and thought, let me give this a shot. I don't take it on. I don't take, by practicing empathy, actually sets boundaries, and it sets safe boundaries. And what happens is the more that you provide an empathic environment, is what I'm finding is the less, that's where the less burnout comes in. And that's definitely been my experience because I'm not taking it on. I don't get in that hole with the patients. When a patient comes in, and speaking purely from my experience, and I kind of feel that energy that they're mad. Before I started this work, and here I'm going to be vulnerable and be brave and say, in the past I would have taken it personally, or I thought, man, what a jerk. I can't believe this person's acting like that. But if I start to go back and really look at those core emotions, 90% of the time this person's just really afraid. And go back to that slide that I showed at the very beginning, that they didn't plan this. Their brain was erased and they don't have a backup, and they may be coming across as really, really mad, but they're most likely afraid. So the more that you drop into stillness, and I know that sounds a little bit woo-woo, but the more I used to attack back and match that energy. And now that I drop down into a stillness and provide that safe environment and that empathic environment, and let them know that I am seeing them, it truly actually helps to reset the tone in the room. That's the other stuff that I want to add. When in doubt, go back to the 4 Agreements by Don Miguel Ruiz. We can't take anything personally. And even if you feel like, wow, that person's really beating me up right now, it's not about you. This person's just in pain right now. They're really trying to figure all this out. So that's where I have just truly found that the more I do this, the more I actually, like I keep saying, kind of sets the tone, and the patient will feel that from you and understand that they're also in a safe environment.
Lynn, I'm curious, everybody on the call today seems to be mostly healthcare providers, and you and I talked about this a little bit, but for folks that are consumers of healthcare, can you give me any advice about, and I know that we'll have people who watch this webinar as a recording, but for those of us who are patients who are looking for a little more empathy and a little bit more compassion from our healthcare providers, what is it that we as patients can do to sort of establish that or hopefully elicit that kind of care?
Oh, I love that question. Yeah. Well, first of all, depending on the situation, and that's I've been in that situation also as a patient and a consumer. People, permission to be human. There's people that just may not be able to catch on to that empathic way, and maybe they just don't, or they're not capable. And the way I've learned to do this is I did have a situation where there was something very specific that I needed, and it was very high tech, and it was very difficult to find this one person in the United States that was able to fix this thing for me and my ankle. And I really needed him. And he wasn't warm and fuzzy. He wasn't going to meet me there. He wasn't going to make me emotionally feel better. And once I got beyond that, I realized, okay, but he actually is going to fix everything that I need. And it did. So I think permission to let that provider be human if you need them to do that. Understand that they may just not be capable, but if you're going to get the physical care that you need, just understand that you're not going to get that empathic response. Now, I'm saying that when you don't quite have a choice and you can kind of take a step back and understand if you're not getting that empathy, it's not about you either. That person's just not willing, they're just not going to give it. However, I did go to get my eyes checked, and there's lots of ophthalmologists around, and I got zero empathy from this person. I couldn't even tell you the doctor's name. I don't think he looked at me, saw me, nothing. And I basically had to tackle him to say, hey, buddy, I actually do have a question for you that I'm really concerned about, and I waited 2 months to ask you this question. Please sit down. I don't have to go back to him. I did go back to my primary care physician and say, I need to find, please help me find somebody who's actually going to listen. So when you have a choice, make that choice and leave and find somebody who's a better fit for you, because it is about getting the care that you need. Again, sometimes you may be in a position with a specialist who take from it what you can, and then a really turn around, maybe have some empathy for the fact that their communication skills are not where their expertise lies. Hopefully that was helpful.
Yeah, oh, great. I'm going to guess that people might come up with questions later. We don't have any right now, Lynn, so thank you for providing your email address. And we just have one that came in from Shannon. Hang on, let me read this for you. Shannon's wondering if you have any recommendations for counseling patients who are not progressing in therapy and how empathy can be used. Although you are telling them something they may not want to hear. For example, continued therapy may not be recommended. Just to summarize, recommendations for counseling patients who are not progressing.
No, it's a good question. I think acknowledging how far they've come. What I tend to do then too is say no more therapy will actually change your outcome at this point. But you do have the tools to continue to take it from here. And there's nothing else that I can provide for you now. To me, it's an honest way. That's what I typically do with my patients. I say, you've gotten everything that you're going to get from me at this point. So your options include this, this, and this. That's how I typically hold it. And I don't... staying out of shaming, and hopefully that's a whole nother talk. That's all Brené Brown's work. But I stay away from shaming and blaming. I say this is what we've been able to get so far, and this is how far we've been able to come in therapy. But I never bring up because you didn't do such and such. I absolutely stay away from that.
Well, Lynn, thank you so much for this. I have to say personally, the video of Brené Brown's comments about how to respond, simply saying that you're glad that somebody told you something, that was really moving for me, and something that I definitely plan to use in my life when I'm having difficult conversations with people. So thank you so much again for doing this for our Boston University alumni. I really appreciate the time that you put into it.
Yeah, thanks. It was my pleasure. And like anytime people have questions that pop up later, I'd be happy to answer them through email.
That's great. I also want to thank all of our guests for participating today. Specifically, I want to thank our donors, people who've donated to BU in the past. We wouldn't be able to put on programs like this without your support. Our webinar series is actually going to be on hiatus for the month of August, so hopefully everybody gets outside and enjoys some sun on their lunch hour. But we'll soon be announcing the full lineup of Industry Insider and professional development webinars for the fall, so please stay tuned. And as mentioned earlier, you can also view all of our library of previously recorded on-demand webinars on our website at bu.edu/alumni. And as always, if you or any BU alum you know would be interested in presenting a webinar like this for the BU alumni community, I'd ask that you please contact me at the Alumni Relations Office or by email at jtmurphy@bu.edu. Thank you everybody for your time. Have a great day or a great evening wherever you might be.